Hi, I'm Amanda. I'm originally from Montreal. I completed my bachelor's degree and master's degree at Concordia University in biology. I then pursued a certificate in biotechnology, which allowed me the opportunity to complete an internship with Lallemand Health Solutions as a R&D intern. During this internship, I had the opportunity to do sample analysis for clinical studies, as well as develop some new methods. After my internship, I was able to come back as a research scientist. And a lot of my projects involve developing new methods or new ways to analyze our samples at our labs. And in 2022, I had the opportunity to become the clinical laboratory manager. It was actually my supervisor at Lallemand, the research scientist who hired me as an intern. I then was able to come back and take over her position because she also moved within the company as well. I saw her growth within the company. She started off as an intern as well, moved around to different business units, and then was at Lallemand Health Solutions. And now she was moving again within the company. And I was able to see, I took her role and responsibilities, and then she shifted over. What was really cool is we got to keep working together. So we still work together today, which is really nice. Part of my tasks include not only managing the laboratory, but also all the clinical sample analysis that takes place from the samples collected during our clinical studies. We collect different sample types, such as stool, vaginal swabs, breast milk, saliva. All those samples are collected and they come to our laboratory where the analysis takes place. So what's really interesting about the work we do is when we're running a clinical trial, the goal is to understand the health benefit that the probiotic can have for individuals. What was cool is after I could go to the shelves and identify which products belong to or which strains belong to Lallemand Health Solutions. As a user of probiotics and of coming from a family who used probiotics even before I entered the industry, it was interesting to see when you see the health claim on the label, how it came to be. And as the clinical laboratory, we get to participate in that because the analysis of the samples takes place in this laboratory. And we are the ones receiving the samples, analyzing them, both in the lab and also the data, and then sharing this data with other departments or other teams that can then help understand why we see these benefits in certain populations or provide material to marketing who can then use it to disperse to the clientele. We not only collaborate within the clinical team or within the R&D group, but we also collaborate with other universities or research groups as well. This collaboration can be on various levels. It could be just providing support. It could be providing support with the analysis. It could be doing the analysis or assisting the analysis. Sometimes we have some students who don't have a background as much in molecular biology, and they'll come on site and we'll give them the training and the expertise and the lab space sometimes to be able to perform the analysis on their own. So we have that collaboration with them in supporting them and their research. I think the team I work with is definitely something that keeps me motivated. Just the people I interact with every day. We have 2 clinical laboratory assistants that I work with daily, as well as intern. And just working with them and creating that environment where it's kind of an exponential growth of excitement and motivation, especially, sometimes when you're doing the analysis, it can be very repetitive and, you get like, oh, come on. But then when you see the results, it's all worth it, especially when you're doing it all together. You're going as a team together. I find that really exciting. I'm proud to be a woman in science because it shows that I followed my passion and interests. And it's not always easy. Science is not a straightforward path. It's not a one-size-fits-all where everybody follows the same process. Sometimes you have to make your own path or take a little detour. It's a journey. You're always learning and growing. If someone were to be hesitating whether or not to pursue a degree in science or pursue science as a career, some advice I can offer is to make sure you're always following your interests, your passion, and also your curiosity. So you really have to have that motivation and that drive to want to continue to pursue it, and also curiosity, because in science, you need to keep your curiosity there. Always ask questions in order to keep evolving.